Hi, everybody. I'm Mallory.
And I'm Char.
And we are from Montana Medical Aesthetics Clinic in Billings, Montana. We are starting a podcast, so we thought we would introduce ourselves and give you a little background info.
All right, so I have been a nurse for many decades, and I did start out in the hospital for 23 years doing a little bit of peds and a little bit of labor and delivery, 18 years of labor actually.
Just a little
before
bit.
before coming to aesthetics in March of 2008. And it was kind of a natural transition, just helping women in one phase of their life to helping mostly women in another phase of their life, which has been really fun. I actually have the privilege, as far as I know, of being the first non-physician injector anesthetic provider in Billings. So
cool.
I've done it a long time, a lot of years. So
you still
love
like
it, love it, still love it, still, for many reasons that we'll share along the way.
Yeah. So I'm also a registered nurse and a nurse practitioner. I worked in the emergency department. I did internal medicine and kind of got thrown into aesthetics in that way. Ended up loving it more than anything else ever. And it's become a passion of mine. So I've been doing it since 2016, doing aesthetics. And again, just love it more and more all the time, which that's unique. And I feel very privileged. That's part of, I think, why I still do it. It's something that not only I think I'm pretty good at, but I love it. And it's just a very natural space for me. And I love working at Montana Medical Aesthetics. It's a very unique place. I told Char before that we have great clients. And I feel like I belong here and got a great group.
From the minute you walked through the door, I think it was pretty crazy. One thing that I kind of love, I really love about it, kind of want to mention is a lot of areas in healthcare and nursing can be physically and emotionally draining.
Yeah.
And for the most part, this is just fills my cup. It lifts me up. It energizes me in ways that, although I love
that's hard to find in medicine.
I love being a labor nurse.
Sure.
But this is unique.
Yeah. Agreed.
Today, what we want to talk about is biostimulators.
Woohoo.
And biostimulators are not new, but it's kind of a new buzzword.
It's popular.
What it's referring to is anything that we can do for our bodies to make our bodies go to work for us.
Stimulate life. Biostimulator.
Yeah, that's great. Stimulate production of collagen, maybe some muscle, some bone, anywhere like in our skin structures. But, most of us at this point kind of pay attention to from our
investment.
Yeah. And so we want to talk a little bit about the different biostimulators that we have out there.
Sounds good.
And I'll let you just go first.
So today we're going to cover PRP and our PRP plasma biofiller. We'll talk about collagen stimulating threads. We'll talk about Ultherapy and Sculptra.
Yep.
Yeah. Okay. We're not going to forget any this time.
Yeah.
Totally. Okay. So first,
a few little notes here. So we might look down from time to time. We just don't want to forget.
Pay no
anything.
Attention. So one of the first things I want to talk about is PRP. A lot of you will know what PRP is. It stands for platelet-rich plasma. So that's where we draw blood, we spin it in a centrifuge, we are separating the red blood cells, and you're going to separate plasma, and you're going to get a nice little layer full of all the good stuff. We concentrate that into the liquid gold. So that can be injected into the skin. It can be used to make the biofiller. That's going to have the peptides, the growth factors, your own stem cells. The amazing thing about this, it is made just from your blood. It is only for you, and it's pretty amazing. So what we can do is make that PRP into a biofiller that can be injected similarly to how a dermal filler is. So we did my cheeks and under eyes, and I did around my mouth. It was pretty cool. Very excited to be able to do that now. And you're going to get some of volumization like we get from dermal fillers, but you also get that foundational PRP biostimulating effect. So you're going to get a few months probably of that volume, and then meanwhile, that's stimulating the growth. So your skin's going to look better. Your tissues are going to look hydrated, a little bit plumper. And it is really, I can't stop saying exciting because I'm excited about it.
So now I liked that was a question I had. I liked what you said, a few months worth of volumization.
Sure.
So we're talking about kind of the biostimulator thing. It's going to be different than very much predictable outcome from a dermal filler or something.
So the way I've been thinking about it is the PRP biofiller or plasma biofiller is going to be in between how a dermal filler and PRP alone will be, because dermal fillers are made to last a little bit longer, but you're not necessarily going to get that effect of stimulating cell growth and all those kinds of things.
Which is great, but fillers are great, but then you're always kind of on the perpetual hamster wheel.
And they might go great together.
Right.
So you can combine, you can do different things there. We would customize that obviously to what's needed.
I was thinking about something when you were talking too, is maybe we should talk about what somebody might be looking at that might be
a reason to do that instead. Or in addition to. So if you have a lot of volume loss, like mid-face, I would think we're going to need probably some fillers in there. That's really going to do the job of filling up a void maybe. But then that PRP biofiller is going to be like glazing on the top. It's going to just really help that shine come through. I'm kind of thinking about that way. Maybe helping with the dark under eye circles, that kind of thing.
So, and the way I know I kind of talk about it is, it's your long game. It's your marathon. It's not your rapid weight loss, but your maintenance. It's fertilizing your lawn so that it stays green throughout and weed free throughout the season. Beautiful. Anything like that.
Whereas the PRP, you're not going to get that instant gratification from PRP alone.
Right.
That's really long game, but you don't get much up front. Whereas the PRP biofiller, you get a little bit of that volume, but then you're also doing the long. So that's kind of the intermediate thing there.
So now I'm always an advocate that it's never a one and done.
Right.
So is there...
Yeah, so we would want to do this. Again, you're going to get a few months out of the volumization. So you're going to want to probably do this 3 to 4 times a year, the PRP biofiller.
Like forever. You don't get to the point where it's just going to be...
I would say that's going to depend on a lot of factors.
That's true.
How much collagen can I make? Can we stimulate from your plasma?
So like anything else, depends on the age you begin, the amount of laxity, amount of sun history you have, your genetics, your heritage, all the things. And it's subjective, right? Yes. It's kind of what I would be happy with versus what somebody else might be happy with.
So I think start that first year, do every 3 to 4 months, and then see. After that, you might already be ready for maintenance once, twice a year. You might want to do another 6 months of that program.
So not cookie cutter planning, but individualized. Sorry. Yeah, right?
Short answer long.
Individualized. Yeah. All right. Excellent.
I think that's...
I like it.
Yeah.
So now tell me about, when you had, I haven't had it. Oh, sorry. I'm probably banging on that mic. I haven't had it done yet.
We should video that.
Yeah. Oh, that'd be good. Maybe we'll do that one day. And, but you had it. What did you think it felt like compared to filler?
Okay. So I injected myself, which I do every so often when Char is busy. And, it feels a little bit different. I've experimented with adding a little bit of like lidocaine and some buffer to help neutralize that so it's not offensive, and it really wasn't bad. I used cannula, so a lot less bruising. I did get a little bruising around my mouth, but I think for most people I can avoid that. It's just kind of a difficult angle. But yeah, it was not terrible.
That's good.
Similar, maybe a little bit spicier than dermal filler.
When she was done, she was a little bright red, and you kind of massaged a little bit. And were you using ice? I don't remember.
I did not.
Okay.
No.
But within
hours, it looked like normal and an improvement you could see right away. But right afterward, I thought, oh, okay, I can see what I did there. And then a couple hours later, I took another picture, which I'm really glad I did. I'll have to see if we can get those pictures up in there for you guys. Because it was like, wow, that didn't take long to look pretty good.
Right. And then your husband, that was kind of fun.
Yeah, he noticed.
She went home and he just kind of looked at her and, did you do something today or what, and then she told him what she'd done.
It could have been because I walked through the door like this.
Look at me. And then she told him and he kind of looked and he went, oh,
yeah,
well, it looks nice.
Yep. So that's always good. So, yeah. What'd you do now?
And why? So that was good.
So I'm excited for that one. Feel free, come in, ask what we think, how you could benefit from that, or if we might recommend something else to start with, or how we would get that into your regimen.
Great. And then I'll talk about kind of on the same plane, Sculptra. And Sculptra is a biostimulator product from Galderma, the same company that makes Dysport and the same company that makes Restylane fillers. And Sculptra's been around for a long, long time. Sculptra helps us, depending on the depth and the placement of the product, it can help our bodies grow muscle, bone, and collagen, depending on the layer that and where we place it. It was first available for treatment as a medical device, and they treated people who had AIDS and became very volume depleted and, for lack of a better term, kind of skeletal looking. And by receiving this treatment, they had really safe, effective production of collagen, muscle and bone, and had a more normalized appearance. And I love the safety factor of that. And it became a cosmetic aesthetic treatment following that. It is not new to the aesthetics. I was first trained on it in 2008. It has recently just kind of been given new life and kind of taken off a little bit. So they've been able to, they had
Did you say it got biostimulated?
It got biostimulated.
Sorry. Good.
These are the jokes.
I'm done. Go ahead.
They had some issues in the way they rolled it out initially. They changed the amount of diluent that went in it from when they were using it as a medical device to a cosmetic device, and then they had to resubmit all the studies before they could really promote it. So that's why it seems like it's really a new device, but it's not. But they are safety just first. Within the last year and a half or so, really been able to promote it, and it's great.
I've been asked a lot more about it.
Yes, I think it's been seen. It definitely is your fertilizer. We inject it laterally in the face, laterally in the chin, across the upper lip. You can go down here in this area here called the piriform aperture to provide support along the zygoma, along the jawline, anywhere. We want to add bulk to the back of our faces. Our faces naturally, as we age, they don't just fall down, they front load first. Everything comes forward and then it falls down. So if we can get everything, back this way, plumped up again, it helps support everything else. So that is always our goal, is to add support to the lateral face, lateral chin, lateral aspects across the upper lip. Sculptra does have a little bit of audience participation. You need to, following being injected for 5 days, 5 times a day,
5 minutes.
For 5 minutes. Thank you. You need to
it's tricky
massage.
To remember that 5.
Yeah, 5 by 5. You need to massage the treated area. And it's not just a gentle little rubbing. I mean, it's a get in there and just the idea is to keep that product dispersed around the area that it was injected, because facial movements are dynamic, and muscle movements, and it can tend to coagulate or draw things together into one place, and we want to keep those dispersed. And what we've kind of suggested to patients is those little jade rollers tend to work really well, and you can even keep it in your refrigerator, and so it's nice and cool. Many people have told me they just actually ended up enjoying that 5 minutes, 5 times a day of massage, so much that they thought they'd continue doing it a little bit. So
that's a good idea.
Yeah. So I really love it. We place it both with cannula and with needle to get it where we want it to go. And so it's a good one. It's really popular. We can treat face, neck, chest, even like tops of knees, anywhere we have some crepey skin that we want to improve.
Yeah, I like that.
Yeah.
What would you think if somebody asked you, should I do Sculptra or should I do the PRP?
Oh, great question. There are certain people that definitely have a very strong opinion about using something more organic to them or natural. And that person would really benefit from, I mean, and I think appreciate the PRP better.
Yeah.
I think that you're going to have more treatments probably with PRP and PRP gel filler to maybe get the same effect, but you're still going to have like 5 to 6 vials of Sculptra in a year's time frame, and then after that we just talk about it being yearly maintenance. You know, so I think it just comes down to personal preference.
Collagen stimulating threads. Oh, I love these. So we have 2 different kinds of threads. We have the lifting threads, and then we have the collagen stimulating threads. So lifting threads are, you know, we put through the mid and lower face very commonly. We can also do brow lift and things, but those are going to lift. Like we talked about front loading, your tissues kind of falling down and forward. And so the lifting threads are going to go up and back. Our collagen stimulating threads are going to go in, like we were talking about, the crepey skin. So they're going to stimulate collagen. That's why we named them that. And you can...
We're so creative.
And so those are going to go in via needle. Those are going to be inserted underneath the skin. And we can help kind of control the depth. And so they were great for like my acne scars and my cheeks, because those are notoriously difficult. They're varied in depth and everything. And so I think that the collagen stimulating threads were really good for that. They can be great for little creases in the skin. Glabella lines, those 11s that, you know, if they're really resistant to Botox because now it's on the skin and it's showing up there, great combination therapy. Upper lip, those vertical lip lines. We won't call them smoker's lines. Those vertical lip lines, those are very stubborn and hard to treat.
The volume loss lines.
They're volume loss, yeah. It's a area with tons of movement. So we need to, I mean, basically anywhere you have skin, you can put those collagen stimulating threads. So good. Those are just going to create a little bit of irritation underneath the skin. Not enough that you're really going to see all that much even on the outside, but they're great at stimulating collagen. So
kind of amazing.
It is. It really is. So those are PDO, polydioxanone, whereas the Sculptra is PLLA. Polyolactic acid. So not 1000% natural, but they're very well tolerated.
Yeah.
Might have a little bit of bruising. So if you're thinking about doing that, a good idea to pre-treat with arnica maybe.
And plan it on a day, you know, not just the day before you have family photos or some event that you want to
plan accordingly.
Yeah. And maybe I'm going to do. Mallory's going to put some across my upper lip, also because I want to. I don't have deep lines, but
let's keep it that way.
Yeah, I want to prevent. I do have some. I did put a little neurotoxin across my lip last Friday after work, and that has really helped because it just keeps that muscle. It's a sphincter muscle, so it keeps it from contracting quite as much as it would want to otherwise. I don't think it's inhibited my ability to speak or anything like that.
Beautifully.
So, but I did want to do it in that order because I wanted to slow down that contraction a little bit, because I thought then putting the threads in might be just a little bit more comfortable. For a couple days.
I do think that's a good idea. Forehead, glabella as well. High movement areas. Pre-treat with a neuromodulator to help calm that movement down, so that you're not working it against the threads. Yeah. That's helpful.
And we have some, you know, we can use some ice prior to, and we can, or a cold blow, or some things that we can do to constrict those vessels and mitigate bruising as much as possible.
Agreed.
With some treatments following the bruising caused by some injection treatments or that kind of thing, we can do some BBL to break that bruising up, but not with threads, because we don't want that deep penetrating heat can work to break that thread down more quickly, and we don't want that. So that's just one place, or after one thing where we can't offer the BBL for that.
Right.
I haven't ever seen anybody allergic to those.
No, I haven't run into that, come across it, heard of it. No. So those ones though, I would recommend do as many as you feel comfortable doing at once, and then
That's a
plan
good
for a
idea.
series.
Yeah,
About a
that's a
month
good idea.
apart, we say do 2 or 3 and then kind of see what kind of results you're getting. It's one of those things too. I feel like a lot of these with collagen stimulating treatments, you sometimes might feel it before you can actually see results. So like before and after pictures, we can do everything possible to really zone in on what we're seeing. It's so different what a camera lens captures versus what our eyes capture. And you can kind of feel like, oh yeah, my skin feels like so much healthier, plumper, juicier
than what a photo demonstrates.
than what a photo can.
Yeah.
Sometimes we can see it and sometimes it comes out great. But before that can happen, I think we can even feel it sooner than, and it just, in that sense, you get a really natural result. No one's going to go like, oh, that line you had is gone. What'd you put in there? Nobody's going to know that. They're just going to go, wow, you look really good.
Right.
Which
now, I've only done it once around the eyes. Have you? You've done more than that, right?
The collagen stimulating?
Yeah. Yes, for people.
Oh, yeah.
Yeah. And have you, I know that they, this is another really high bruise area. So
it is.
The gal that I did, I've seen her since and she appreciated the effect, but she did bruise kind of badly.
Yeah. Once I started using the Zimmer cooler more, it really did shrink up those vessels. And the most recent one that I did, she didn't bruise
at all.
I was really impressed because that is a tricky area.
Yeah.
So,
I've been particularly impressed by the changes in upper lips.
Yeah.
Particularly impressed.
Oh, absolutely.
With the threads.
I mean, and stubborn. Those are stubborn lines. And
because with those lines, we mostly talk about wanting them we want to soften them and diminish them rather than think that we're going to completely correct them. Because once they're there, they're kind of there. And that's why we want to get on top of them as quickly as possible. But it's been really good.
And honestly, my best results there in that area, because you think about aging at different depths and on different levels,
that's a good idea.
So the Botox is going to help calm that muscle movement. So you're creasing less. You need a skin treatment or collagen production to make it more resistant to that creasing. And then sometimes we need filler to just get in there and kind of help fill up the volume depletion. So my best results have been with that combination. And actually, after we did the Botox, she wasn't as crazy about that. So we just did the threads and the filler. Just really, still really good. Yeah, really, really great results. Yeah.
One more thing, Ultherapy. Ultherapy is ultrasound-driven heat. When you have an ultrasound of an abdomen or an OB ultrasound, it's a single ultrasound wave that is meant to go through fluid-filled spaces and bounce off solid surfaces like bone and that kind of thing. When we're talking about ultrasound-driven device to create heat, they take multiple waves of ultrasound and they combine them into a single point, and that does create heat. And this heat with the Ultherapy can be directed very deep into the tissue. It goes down to that right at the top of the muscle, that shiny layer right on top of meat that you buy, that's collagen, and it goes down to that depth, deeper than anything else that we can do with infrared light and heat or radio frequency. So the Ultherapy goes the deepest, and the deeper something goes, the hotter the temperature can safely be delivered. And so Ultherapy heats that internal temperature of that skin up to 65 degrees Celsius, which is over 135 degrees Fahrenheit. And then that causes all these micro injuries, heat-based injuries, and then your body goes to work and heals those little injuries, and you get then the result of some skin tightening. It really is the deepest, most significant amount of skin tightening you can achieve non-surgically from a non-invasive device. So there's no needles or anything, like it doesn't break the skin. So Ultherapy has a little bit of discomfort associated with it. Anybody that's done it or maybe has looked into it, it can be a limiting factor for some people, but we do offer a little bit of medication that can help you stay relaxed. We require you to have a driver to bring you in and take you home with that. But Ultherapy is an amazing choice.
Definitely.
Again, the more collagen you have to begin with, the more collagen you're going to make. You have to have collagen to make collagen. So it's not the right choice for everybody, because somebody that has very thin skin already, that kind of thing, might be served better with one of the other collagen stimulating treatments before they do Ultherapy. But Ultherapy is a really great option also. I have my last on my neck. in November.
Yeah. And it does take some time to see those results, right?
Yeah. It takes, they say the peak results around 6 months.
Okay.
It's well documented in the literature that there's even some changes up to a year after. So
that's amazing.
We try to encourage people. This would be a yearly treatment. Again, it's the marathon, not the race.
And I was thinking in my head about time-wise, if you're like, I only have time to do one thing, what's the number one thing that I could do to do collagen stimulation to be a biostimulator, you would say?
If you had one thing, I would say all therapy.
Yeah. And if you were like, I absolutely cannot tolerate pain, I will do whatever I have to do as many times as I have to do it, but spare me, make me as comfortable as possible, what would you say?
I'd say Sculptra.
Yeah, I agree. I agree that we do mix that with lidocaine too. So
yes, that's a good point. Yeah. We try to make everybody as comfortable as possible during any of the procedures. So yeah, I would say Sculptra. If you want to have more frequent stimulation of collagen, I'm going to say PRP. Yeah, PRP gel filler. That's going to be. And if you want more directive, like isolated, very area specific, it's going to be the threads.
Collagen stimulating threads. Yeah. So that helps kind of narrow down maybe if you're thinking about any of those things. That might be a good way to wrap it up. Yeah.
We thought we'd do one thing at the end of, try to do one thing at the end of every video and just talk about maybe a product or something that we're kind of excited about right now.
The week's obsession.
And mine is this image
to grab mine.
Prevention primer. It's also an SPF 50. I don't know. I'm sorry. That probably washes completely out there. Yeah? Yeah. Okay. Good. It is an SPF 50. It's very lightweight. So a primer's purpose is just primers kind of make your skin cells swell a little bit. So their purpose is to even out the playing field. So they're going to make your pore size a little bit smaller, kind of, they're going to even out some or minimize some fine lines, and then anything else you put on top of that, like a foundation or anything like that, is going to go on more smoothly, and you use less of your product. So I just really love this, and I love the fact that it's already my SPF. I'm lazy. I want to use as few things as possible.
I like it.
And be done with anything as quickly as possible.
And what's your personal obsession this week?
Oh, Marisa turns 50. Happy birthday, Marisa.
Throw her under the bus.
I think,
are you asking permission or forgiveness for that one?
So, yay. Happy birthday.
Yay, Marisa. Okay, so my obsession, I forgot about this segment, so I didn't bring it in here, but it is going to be the Biome Plus. This one is actually the cleansing balm, which I also love, but my obsession is the cloud cream from them. It is like, if you feel it, it feels like a marshmallow cream. Oh yeah,
that's exactly what I was going to say.
Oh, it's like so good.
I'm using it also. I love it.
And then your skin feels like that. It is the best. It is amazing. So I am obsessed with that. I bought it. I bought some for my mother-in-law who's coming to visit. I'm like, oh, you want to try something new? Try this stuff. It's so good. So that's my new obsession. It is fabulous.
Yeah, it's good.
Yeah.
And then
and my personal obsession, I'm still on the duck thing. We are... If any of you guys have seen me since I've been back from maternity leave, we decided to start an adventure with ducklings. And so the adventure continues, and we now have 4 baby ducklings at home that eventually
you're hoping are girls.
I'm hoping are girls, and eventually we will get eggs from. So wish me luck.
Yep. And you have 2 boys?
We have 2 boys.
2 boys that you know, and hopefully 4 girls.
Hopefully 3 or 4 girls, yeah.
Okay. All right, so we would love your help to gain some little followers here. And so if you would please like this video, subscribe, and comment below
we would
just to say hi. We would love it.
Thank you in advance.